Okay, so we're talking about artificial intelligence and the future of healthcare in Africa. And I have so much to share and so little time. I'm going to move a bit fast. If I'm going too fast, just let me know. I have a tendency to speak fast, but it's going to be a great time. And so Kinoti has shared a bit about me. I was born in Nigeria, grew up in Nigeria, came to Canada in 2003, about 22 years ago. I've had the opportunity to go to school different places. Somebody once told me that I went to too much, I have too much schooling done. Maybe they are right, maybe they are wrong. But again, they've been laying an opportunity for me. I've also had the opportunity to work in different industries across different parts of the world, from accounting, PricewaterhouseCoopers, from banking to health to different things. And again, one person told me that I have a diverse experience. Somebody else said, "Wow, you must be a confused person. Pick a spot, stay in it." Whichever way, my journey, I continue to learn. In my current role at Informanos, I'm the Chief AI Officer, working with the team on our upward feedback platform, and also uh, working with the team on upward feedback platform, our advanced analytics dashboard, leveraging AI for analysis. And we had a project that we did with the downtown Kingston around collecting feedback from the residents and analyzing it. A project close to my heart, working with 1 million teachers to launch the 1 million Teachers Leadership and Technical and Leadership Institute. Our goal is to see how we can play a role in shaping future technical leaders in Africa, starting with Nigeria. Of course, we also do training, and I have training I do for business leaders, executives, and around artificial intelligence, how they can leverage AI to do things better, faster, quicker, and in some cases to generate revenue. Okay, so let's start with a question I always like to ask. And if you can use the chat function and put your answer in the chat, it would be great. Uh, Based on everything you know about AI, and I know that there are varying knowledge about AI on this call, on this seminar, but based on the little or the much you know, do you believe artificial intelligence will change how your work is being done? A yes or no answer, or maybe, will be helpful. If you can put that in the chat. Yeah, okay, I see. Kidu, yes, very well. Ronald, yes. Nkole, yes. Rediet, yes. Mercy, yes. Aja, yes. Okay, I see a lot of yes. Eta, yes. Mipawa, yes. Caleb, yes. Eva, Gladys, yes. Yes, yes, yes. Okay, very interesting. Yes, yes. Samuel, yes. Jackson, definitely. Kennedy, yes. Marcy, I think in ways we don't even know yet. Andrew says yes. And Samuel Yanko says yes. Okay, next question for you. Thank you very much, everyone. Please keep the answers coming. Um, next question for you. So how soon do you believe AI can take on significant part of the work you do? Today, 3 to 5 years, or longer? How soon do you believe AI can do your work? Right away today, well, 3 to 5 years time, never. Some might say never. There's no way AI can ever do my work. Okay, somebody said already. Somebody said today already. Yes, Kayla says. Istora said, well, it's been doing that already. Okay, I'll just wait for a few more folks to type in their answers. 3 to 5 years, but not all the work. Okay, thank you, Marcy. Ita said 3 years. Hela says partially yes. Gideon cannot, but it will shape to new direction, ever already happening. Just waiting for a few answers, maybe 10 more seconds. Again, how soon do you believe AI can do what you do today? Okay, let's ask one more question. Again, thank you for the answers. Keep them coming. Keep them coming. Okay, I'm going to ask, I think I have one or two more questions. Uh, okay, so let's think about medical doctors. Uh, Most of us have had the opportunity to work with medical doctors or to go to and see a doctor. Do you think AI will redefine the role of doctors within the next 5 to 10 years? Yes, no, maybe, not really sure. What do you think? Do you think AI will redefine what it means to be a doctor? Marita says no. Redia says yes. Rose, yes. Gladys, yes, somehow. Ronald, yes, partly. Marcy, in some parts of the world, maybe. Very good. To keep the answers coming. Leila, potentially. Gideon says yes, it will. Keep the answers coming. Maybe 5 more seconds. Keep the answers coming. Eva, yes. Okay. Hela, yes, but language matters. Interesting. Michael, I don't think so. Maybe in radiology, still far from providing relational clinical expertise. Aja, yes, refining, but not replacing. Eta in diagnosis. Thank you very much. Again, great answers. Let me show you some interesting statistics about doctors. Uh, in Africa, only seven, I'm sure some of you, this is not new information, only 7 African countries, this is based on a data I came across, only 7 African nations meet the World Health Organization recommended recommended doctor to population ratio. Okay, as of 2022, the average doctor to people ratio is 2.6 doctors per 10,000 in Africa. Okay, 2.6 doctors per 10,000 in Africa. This graph here shows the doctors per capita uh, by country. Okay, and you can see Africa is way behind, and some other countries you can have more doctors. Actually, the global average is about 17.2 doctors per 10,000 people. In Africa, it's about 2.6 per 10,000 people. This is based on 2022 data. Europe is about 37, North America about 33, Latin America 20, Asia 15 to 16, Oceania 36.7. And so Africa is at 2.6, and the next lowest is Asia at about 15, which is almost 5 times Africa. And so we see that we have a shortage of doctors. Okay, and here's my last question before I get into my slide, or second to last question. Do you think AI can meaningfully address Africa's doctor shortage in the next decade? Do you think AI can? Okay, Gideon says no, no. Marcy says no. Marlene says no. Laura says no. Ronald said yes, partly. Michael says definitely not. Okay. Samuel, yes, it would make learning easier. Kennedy, maybe. Eva, partly, partially, no, in some ways. Thank you very much for those answers. Very, very interesting. Okay, yes and no, so it's a no. Thank you, Samuel. Aha, Marita, no, especially not in rural areas. Okay, so before I ask my very last question, I want to share a slide. It's a very important, interesting picture. That's uh, my father-in-law, wonderful man, handsome man, very great man. This was when he came to Canada to visit us with my mother-in-law and my family. He's a man of adventure. He liked adventures. When he was in Baltimore, uh, he had an adventure where he went missing for a couple of days, and we went around looking for him. It was not funny. It was one of the most excruciating experience I've ever had in life, driving around the streets of Baltimore and looking for my father-in-law because he was missing. And then in 2021, he passed away. And again, may his soul rest in peace. Great man, I do miss him. But one of the things that I keep thinking about every day is the circumstances surrounding him passing away. And he was sick. Took him to the hospital, and there were a lot of hurdles. One, he couldn't find a space, and then there was power failure, and then he had to get oxygen. So many things that happened that makes me keep thinking about this question. Do you think AI can greatly improve the healthcare system in Africa within the next 5 to 10 years? Can AI be leveraged to improve the healthcare system on our continent over the next decade? Okay, I'm seeing absolutely yes, yes, it can improve. Absolutely yes, yes, yes. And so because we need help. We need as much help as we can get in Africa when it comes to our healthcare system. And so if AI can improve, can be used, can be leveraged to improve our system, then we have a responsibility to learn more, to know more, and to see how we can leverage this technology to make things better, to make life better for a lot of people, and to reduce the mortality rates, the rate at which people are dying in our hospitals or in different parts of Africa. Part of the challenge we have is not just the system, but also we have situations where the folks who are experts, doctors and nurses, uh, are not just overburdened by the system. I mean, think about 2.6 doctors per 10,000 patients, but they also have opportunities to other parts of the world. They have opportunity to leave Africa to go to other parts of the world where they have better resources, they are better paid. In Nigeria we have a word we use, and we call it japa, and so you find that not just in other industry but also in the medical field, in the healthcare sector in Africa, we're seeing a lot of that happening, where folks are finding ways to leave so they can access better, not just financially, but have a better life for they and their family. And so as we think about AI and we think about what and how can AI help to improve the healthcare system in Africa? What does the future of healthcare look like in Africa when we think about AI? It's important to. I'm going to challenge us today in our thinking. I also challenge myself to think not just about the tool as a technology tool, but how can we leverage AI to provide a better experience for patients, to ensure that people have the care they need when they need it and in the form that they need it. And there's already a lot of stuff happening from a healthcare perspective globally. In short, the other day I came across news that says that GPT-5 blows past, posted impressive results on medical reasoning benchmarks, surpassing human medical professionals by substantial margins across diagnostic and multimodal tasks in a new study from Emory University. And so, are we seeing situations where AI is able to do a lot of things as it pertains to healthcare? But before we go too far, what is artificial intelligence? What is this all about? And I'm going to describe what it's all about. But I'm going to look at different industries and keep coming back to the healthcare space. Two main voices in the field. Andrew Ng talked about AI. One of them, Andrew Ng, talked about AI as the new electricity, that it's going to transform every industry and create huge economic value. Joshua Benigo talks about AI not just being about efficiency gains, but about opening up new possibilities, unlocking human potential, and solving some of society's biggest challenges. In 2019 of January, the former CEO of Gini Remedy made an interesting statement back in 2019. She said, because of artificial intelligence, because of AI, every single job, every single industry, including the healthcare space, will be different. Now, when people hear about AI and jobs, sometimes they're like, "Well, I don't know. Should I believe it? Should I not believe it?" But recent news that I've been coming across keeps telling me that most companies are moving in the direction where they are leveraging AI to do more stuff within their organizations. I mean, earlier this year, Shopify CEO said, "Hey, before you hire anybody in my organization, you have to prove to me that the job cannot be done by AI." Anthropic CEO Dario Amodei made a statement a while ago, and he got a lot of backlash on it. He said AI could eliminate half of all entry level white collar jobs. Perplexity CEO came out too, I think in July, to talk about AI could actually take over executive assistants and recruiter jobs sooner than we think. Salesforce CEO said, "Hey, half of the work being done at Salesforce is now being done by AI." And in a similar announcement, Microsoft CEO and Google CEO talked about AI doing 30% of code generation for some of their newer projects. Even from a task perspective, what we're finding is that AI can do certain things better, faster, and in some cases cheaper. Take for example, let's say you ask me, Patrick, create a cartoon character using your headshot, create a 3D character, create a picture with a lion behind the individual. The question is, how long will it take me to accomplish these three tasks with that picture? Now, I hate drawing. I'm very bad at drawing. It may take me months and even months to get started. But I was able to generate this within a few minutes using an application called Midjourney. And so here you see on the right-hand side, you see my animation character, and then on the left-hand side, top left, you see my cartoon character. It doesn't look a lot like me, but good try. And now this was about a year ago. Think about what it can do today. And then, of course, you see the one I really like, me with a lion behind me. The guy is more muscular than I look right now, but again, I'll get to do it in less than a few minutes. And here is a Ghibli rendition of that same image. Coming back to what Ginny Rometty said about AI influencing, changing, or because of AI, every single job will be different. Now, Dario Amode, the CEO of Anthropic, again made this emphatic statement. He said, "Hey, you guys are not telling people the truth about what's coming. I say we as the producers of this technology have a duty and an obligation to be honest about what is coming." I don't think this is on people's radar. And it's interesting because when I talk to people about AI, I mean, I've been in this space, AI analytics for more than 20 years. I talk to people, and my sense is the same as Dario. Folk don't know what is really coming. And most organizations, unfortunately, most leaders are not telling their people the truth for political reasons. They're not telling folk the truth. But when I talk with CEOs and I talk with leaders of organizations, they are asking me, they're thinking about how to integrate AI into their organization to reduce operational expenses and in most cases to reduce headcount. And so it's coming, it's here, and it's going to influence every single sector. Now, I would like us to think about something. I'm going to ask you guys a question. Let me know how old people are. Anybody remember this artifact or this item? What is this? Let me see, folks, for checking in. What is? Anybody remember what this is? Anybody remember? Okay, typewriter, typewriter. Okay, very good, typewriter. Okay, okay, fantastic. Uh, is there anyone that still uses this today? Anybody still using this technology today? Anybody here? You see? No, no, no. Okay. Now, another question. Mr. Nkonde said museums. Okay, another question. If I came to you and I said, hey, guess what? I can type 10,000 words per minute. 10,000 words per minute I can type. And you're an employer. Does that make sense to you? Like, is that relevant to you? They're like, okay, so what? Um, but when this guy was around, it was a big deal to be able to type fast until this guy was replaced by this guy. And so I really believe what Ginny said a couple of years ago, that AI is going to influence and is influencing every single job, every single industry, and it's influencing our world. I remember in 2017, I was speaking somewhere in Toronto, one of the very first time of me speaking in a public place about AI. And I was talking to a group of folks who are QAs, quality assurance specialists. They do QAs on products, on code. And I remember an older gentleman stood up in the middle of my meeting and told me, said, "You're lying. There's no way AI can do what I do." So in 2017, I said, "Sir, I'm very sorry. I didn't mean to offend you. But tell us what you do. Tell us how you do your work. Just explain to us what you do." And so he said, "Well, when I get a product, I start with A, and then I do B, and then I do C, and then I do D." And then his voice started going lower and lower and lower and lower and lower. Because the more he kept describing what he was doing, the more he realized that his process is actually systematic. And he realized that you can teach a bot to do almost everything he does. I tell folks that, I like to use the 80-20 rule, or what is called the Pareto principle. And I tell folks that 80% of what you do today can be automated. 20% is still a bit complex and require human input. But that's mine. That's my own take. So we cannot ignore AI. We cannot spend too much time thinking about it without doing something about it. We cannot allow ourselves to be scared, to be afraid about AI. We cannot take a position that, hey, I don't know, I just don't talk to me about it. I'm doing my own thing. Don't tell me anything about AI. I'm doing my own stuff. And of course, we cannot afford to bury our heads in the sand because whether we like it or not, that train has already left the station. And I think there's a huge opportunity for Africa across every industry, especially in the healthcare space, to see how we can leverage AI to improve the quality of healthcare for the people on the continent. And so we're going to explore the possibilities, opportunities, and see where things are. But before we do, let me come back to this question. What is artificial intelligence? What is it? Well, it is not this guy. Okay. How many folks know this guy? Anybody here, you know this individual. You're like, I know this guy. I've seen this guy before. Anybody know? Aha. Okay. Very good. Okay. I'm not alone. Okay. So again, for a long time, when folks thought about AI, they thought about this guy. They thought about sci-fi movies. Uh, you know, but AI is more than that. For some folks recently, when you ask them about what is AI, they say, well, AI is Chat GPT. AI is Claude. AI is Perplexity. And so for most folks, they think AI is just Chat GPT, but it's a lot bigger than Chat GPT alone. For some folks, when they think about AI, they think about job losses. They're thinking AI is here to take my job. Some other folks think about ethics and privacy when they think about AI. And some folks, when they think about AI, they're thinking about the end of the human race. I read an article yesterday about some AI practitioners who have decided not to retire because they believe that the world is about to come to an end. And so, again, this is the late Steve Hawkins making the same statement that the development of full AI could spell the end of the human race. Interestingly, in 2017, Elon Musk said the same thing. He said AI is highly likely to destroy humans. And the next day, his friend Mark Zuckerberg comes around and says, don't mind Elon, he's pretty irresponsible. Be drinking too much. Don't mind him. Oh, this is being recorded. Okay, I have to be careful. Okay, but no matter what you think, it cannot be ignored. And so for a long time, this was the definition that I used for AI, and I liked it because it was very simple. Even though for a lot of my friends in academic, they will kill me for this very simple definition. But in the broadest term, it really applies to any technique that enables computers to do what we do. Okay, in the broadest term, using logic, if-then rules, decision trees, and machine learning. Okay, again, keep this definition in mind because something changed in 2022, in the fall of 2022, and I think most of us know what happened in that time. Okay, now what is machine learning? Machine learning is based on this idea that you can teach a computer, you can teach a system how to learn. It's a branch of AI based on the idea that systems can learn from data, identify patterns, and make decisions with minimal human intervention. Now, I want to ask you guys a question. How many of you, everything you learned from your undergraduate degree, you're using it at your work today? Anybody here? Everything you learned from your undergraduate degree, you're using it at work today. Just type yes or no. If you type, okay, maybe Jackson said 10%, okay. Someone said no. Okay. Kennedy said yes. Kennedy, you have to tell me the school you went to. I need to send my kids there using everything you learned. Wow, amazing. Okay, glad he said no way, no way. Okay, somebody said 2%. Okay, don't tell me your school because I won't send my kids there. Okay, 5%. Andrew say yes. Andrew, you have to tell me your university. I need to send my kids there. Okay, so what happened? Is that I said 50%. Thank you very much. So what happens? You go to school for 4 years. If you're a medical doctor for 14 years, but you go to school for a while, for a long time, and then you leave school and you start working and you realize that not everything you learned in school can be applied at your place of work. And so, based on exposure to information, to data, to knowledge, You have to unlearn some things you learned in school and relearn some new things at work. And you also discover that that's the way life is throughout life. As you grow in your career, you're learning, you're unlearning, you're learning, you're unlearning. And so your capacity to learn and unlearn can influence your capacity to be more productive, to grow, and to be successful. And so, what if we can teach and train machines how to learn? And teach them how to learn, then we don't have to code every possible scenario. Then all you have to do is to expose it to a new environment. By itself, it will unlearn and relearn based on the exposure to new environment, based on the exposure to new sets of data. That's what machine learning is really all about. Now, I'm trying to keep my definition very simple at a high level. That's what it's all about. Now, within machine learning, there are different aspect, you have what is called supervised learning, where the model is using known input and output to generalize future output. You have unsupervised learning. The model has to find patterns by itself without any training or initial help. And then you have reinforcement learning, where the model interacts with the environment and learns to take action that will maximize results. And so with supervised learning, you train the model, and based on that training, it can generate output. An example of where you can see supervised learning: fraud detection, customer retention, product sales. In the healthcare space, supervised learning is can be examples. You can have AI models trained on labeled X-rays, okay, healthy versus pneumonia, to detect tuberculosis or even COVID-19. You can predict patient blood sugar levels or risk scores based on historical clinical data. Okay, you can have AI trained to identify malignant versus benign tumors based on historical data. And it could even predict the likelihood a patient will return to hospital within 30 days. Okay, that's an example of supervised learning within machine learning. And then, of course, you have unsupervised learning, where again it's must uncover and create the label itself without prior data to use. Within the medical space, some examples could include patient clustering for personalized medicine, disease outbreak detection. And so you can leverage unsupervised learning to identify unusual patterns in clinic visits, pharmacy sales, or social media to detect outbreaks like cholera. And so you can leverage, again, machine learning, unsupervised learning. And in medical imaging and gene sequencing, you can also leverage, or you can see machine learning being applied. Reinforcement learning, again, the model learns by interacting with an environment and receiving rewards or penalties. An example is AI for sepsis treatment in ICUs. And it's a paper that was published a while ago by some folks who, again, who leverage reinforcement learning agents uh, to uh, to put in place optimal treatment strategies for sepsis in intensive care. And so we see this use of machine learning techniques in the healthcare in different spaces for either it's supervised learning, unsupervised learning, or reinforcement learning. And so and then something happened. I mentioned something happened in fall of 2022. That was when Chat GPT came online. And then suddenly we start talking about the concept of generative AI. So what is generative AI? When you think about generative AI, it really refers to a class of AI, or artificial intelligence systems, designed to generate new content or data that is similar to what humans might produce. These systems are capable of creating original content, such as text, images, audio, and even video, based on patterns and examples learned from large data sets. You know, I remember I always say that Gen AI is a professor's worst nightmare. When I was the dean at the college, a lot of my faculty were really troubled by students' ability to access these tools, because then it's hard to prove that an output, an assignment, a test, a project was plagiarized. How do you prove it's plagiarized when the content is brand new? You can't compare it to previous work. And so that created a lot of headaches for my faculty, and we came up with policies on how to um, um, encourage the use of AI while also discouraging the use within certain context. And so with Gen AI, now we can translate languages, we can write new songs, you can answer some research questions, you can generate computer code, you can build proposals. I mean, you can edit resumes and cover letters. You can do a lot of things and create a lot of new materials with generative AI. And ChatGPT is one of the most popular LLMs out there. The GPT in ChatGPT stands for Generative Pre-trained Transformer. Generative means it creates or generates content. Pre-trained, the model is trained on vast amounts of data. And Transformer, that's the architecture of GPT, or the technology that really drives the technology. And so you have these large language models that are now able to generate output, generate responses, answer questions, or follow instructions in a natural way. And so, for example, think about medical chatbots that offer maternal health advice in local languages. Think about being able to summarize patient records for clinicians. Think about supporting diagnostics by generating structured medical reports with these LLMs. Again, they're trained on massive text and they're trained to recognize patterns. Now, one key thing about these LLMs I talk about is multi-modality, which means that they can process and generate more than one type of input and output, not just text. And so instead of being limited to typing and reading words, they can work across different modes or modalities of data. That includes text, they can read and write text, images, they can analyze x-rays, generate diagrams, describe a photo, audio, listening to speech, video, interpreting video frames, summarizing what's happening, and even reading and writing computer programs. In healthcare, that's amazing because medicine is not just about words. And so with a multimodal AI, you could read patient notes, analyze MRI scans, listen to a doctor's spoken dictation, then combine all of that into a useful report. And again, there are a lot of it's the key ones out there that for me is the top ones: ChatGPT, Llama, Gemini, Perplexity, Claude, and Growth. The one thing to know about these LLMs is the word tokens. Tokens are like the building blocks of language for LLM, just like you speak English or Igbo or Yoruba or Hausa or Swahili. LLMs speak tokens. Okay, and so a token is a piece of text that LLMs use at the smallest unit of understanding. It can be a word, part of a word, a single character, or even a space. Okay, and when you type something into an LLM, the text is broken into tokens. The model processes these tokens, understands the relationship, and then generates tokens as an output. Again, breaking text into tokens makes it easier for LLMs to process languages. Each LLM has what is called the context window or the maximum number of tokens that it can support in a session. And the token limit or context window, it kind of tells you when you have to almost reset with new interactions once you've reached that maximum number of tokens. And so with Gen AI, the word prompt engineering now becomes very key because generative AI, you're generating an output based on an input, which most times is either language or audio, but most times it's text. And so the prompt engineering becomes very important. Why? Because the goal now becomes how do I influence the AI model generation in a way that it can produce more accurate, relevant, and context-aware responses. Generative AI. Okay, with predictive AI, we're looking at future outcomes using past data. With generative AI, we're trying to create new insights, content, or solutions. Okay, and so predictive AI, learning from past data, predicting answers, what is likely to happen. For example, predicting tuberculosis hotspots. Strength is planning and prevention versus communication and innovation. With generative AI, you can create new data and you can answer the question, what can we create? And so generative AI is amazing because there's a lot of tools out there that you can use to optimize your workflow. A lot of tools out there, a lot of us are using transcripts, AI transcripts for meetings. You have author.ai. Zoom has theirs. You have tools that enable you to build websites without knowing how to code, without having to code. You have tools. This is one of my best generative AI tools. I love Gamma. I use it to create powerful presentations, documents, and websites. No design or coding skills required. And then you have tools that enable you to create videos or training, or where you can create an avatar of yourself and you have yourself speaking like I'm speaking, and without you having to be there physically. Now, this is me. This is not my avatar. This is not AI. This is Patrick. But in the future, you can have an avatar of me like speaking, and I'm not there. And so you have tools today that can do that already. Most of all are using Microsoft Copilot, where you're able to generate new content in Copilot. Copilot in Excel. Excel now has a Copilot function that enables you to generate output within Excel, leveraging the Copilot function. And if you're using Salesforce, of course, you have Einstein GPT that's at work within Salesforce. Now, in the medical space, AI is being used to spot uh, cancers even better than experts. Now, this was back in 2018. Nurses looking at how can they leverage AI within their practice. Kingston, where I live, Kingston Hospital, the first in Canada to adopt AI tool for heart disease diagnosis, which is again fantastic. And I also know that in Africa, there's a few companies that are doing certain things with AI from a predictive perspective, from a generative perspective. This company here, again, still in progress, they're developing a portable malaria diagnostic device paired with a digital app that processes and visualizes disease data. Afia, again, is utilizing AI-powered analytics on healthcare data to support decision making in clinics and hospitals. Mom Connect is a national SMS WhatsApp-based chatbot platform offering prenatal and postnatal guidance to new mothers. Employs AI to generate localized, again, potential for this to employ generative AI to generate localized conversational health content in real time. And of course, you have this company here, Jacaranda Health, that is looking at leveraging an AI-powered platform to deliver SMS messages and chatbots supporting maternal health. And so, again, you have companies that are doing different things with generative AI and in some cases with predictive AI. And towards the middle of this year, I became interested in knowing, what are the top Gen AI use cases. And this is published by Harvard Business Review. And it will interest you if you look at 2025, the top use case for AI is therapy companionship. Therapy companionship. So people are using AI to find out, I'm having headache. What do I do? I'm lonely. I'm having some challenges personally. So the top use case for AI in 2025 so far is for therapy and companionship. And so we've looked at, what is AI, and looked at different types of AI, predictive AI and and generative AI. Um, so there are lots of opportunities, but I'm here to also tell you as I begin to gently wrap up that there is an uphill battle for us to leverage AI in Africa when it comes to healthcare. Uphill battle for us, not insurmountable, but uphill. Uh, One is around bias, okay, data bias. How do we ensure that the systems we are using, they are trained with local data, with contextual data, so that the output, the recommendations are really accurate. So I got this from Forbes, I think about a couple of years ago. This was a prediction by an AI application. It said the first picture is a ceremony, second is a bride ceremony, third is a ceremony. The last one is person or people. But this is a traditional wedding in Nigeria. It's a wedding. But again, the AI application is not able to predict that this is a wedding because it has been trained with data from North American context. My friends in HR in North America, when I want to make them go crazy, I ask them, am I Gen X or Gen Y? And then they're like, don't you think you're Gen X? I'm like, who told you I'm Gen X? Well, you're Gen X. You are born in this year. I said, but your classification of Gen X is based on North American data. I was born in Africa. And why would you classify me as one of those groups when each of those groups has certain characteristics which is based on North American data? So how do we ensure that these applications are trained using the right African context? There's also LLM hallucination to deal with. That's a big one. How do we ensure that there's no hallucination or if we're catching those hallucinations? And then for us, infrastructure is a big one. I remember last year I was in Lagos and Abuja. I was talking about AI. I was very excited about talking about AI. And somebody asked a question and said, can you talk about AI when we don't have power? We don't even have power to run this stuff, or we don't even have access to internet. I mean, we talk about mobile applications that you can use to do retina scans and eye analysis. We don't even have internet. We don't have data. I mean, some of us, we don't even have computers. We don't have mobile. We don't have the technology. We don't even have the physical artifacts. They're not accessible. And in some cases, they're not even collected or stored properly. What do we do? Okay, because again, if you're looking at using some of these tools, you need data. And so I was talking to somebody the other day, and he said, in a hospital, I won't mention the country or the place, when patients go to the hospital, they are given a paper to fill to complete, and there's no way to transfer that information to a system. So when you come back the next time, the patient has to almost complete it all over again. And so how do we do predictive analytics or predictive AI? How do we do all of this stuff when there is no great process in place for collecting and storing data? What about cost? What about cost? What about the cost of these LLMs? Okay, I'll give you a picture. ChatGPT Plus costs about $20 per month. ChatGPT Pro costs about $200 per month. In Naira, in Nigerian Naira, that's about, so $20 per month is about 30,000 Naira per, it's about 30,000 Naira. That's somebody's salary. That's somebody's full month, 1 month salary in Nigeria. And so if we're looking at these tools to leverage in healthcare, what about access? How many people can afford to access these tools? And so for somebody living in US, it takes them less than an hour or 38 minutes to get that money back that they pay for a monthly subscription. And of course, if you go to the bigger one, $200 per month, that's 300,000 Naira, which is, so for some people, that's their salary for 10 years. 10 years. And so when you think about the healthcare student in Africa, in North America, in different parts of the world, you ask the question, who is at most disadvantage due to the cost barriers that we have to overcome as we use these tools? Of course, there's also the problem with addictions of kids getting addicted to these tools. And for those of us in academia, how do we use these tools uh, ethically? Okay, big question is, should we allow ChatGPT in schools? How do we use these tools ethically? How do we make sure that from a human perspective, we're still facilitating that human to human connection? Niobe Way, psychology professor and founder, talks about the crisis of connection happening in the US. More than 60% of young men are single, nearly twice the rate of unattached young women. Some say, why? I wonder why. Well, guess what? With AI now, you can have an AI spouse, you can have relationships with artificial intelligence. How do we manage this kind of situation? And the last one too is, what about job losses? What happens if we don't need as many people as we have today in the future? Who is responsible for training? Who is responsible for ensuring that people are upskilled, reskilled, and are trained to be ready for that future? Who is responsible? The government, the healthcare institutions in Africa, the NGOs. Who is responsible? What about copyright? Okay, what about copyright challenges and issues? How do we solve for that in Africa? How do we ensure that these technologies, these applications are not using data for which they have not been given the right to access. And of course, the question around privacy and security is a big one. How do we have the right AI policies in place? At the end of the day, it's about leadership. How do we ensure that that our leaders are really, really thinking about the future of healthcare, thinking about AI, and ensuring that these applications are being integrated in an ethical manner across board. Now, I talked about the uphill challenges, but again, I still believe there are opportunities ahead. I was going to play a video, but I'm looking at my time. I don't have the time to play that video, or maybe I will. And it really talks about the concept of AI agents. Okay, that you can have an AI agent uh, help you make decisions. Okay, you know what? I think I'm going to play it because it's important. Let me stop sharing and let me share the video. Give me 1 second here. I think I have a few more minutes left. I'll play the video and then I will wrap up. Thank you for your patience.
Hi, I'm Pete from Manus AI. For the past year, we've been quietly building what we believe is the next evolution in AI. And today, we're launching an early preview of Manus, the first general AI agent. This isn't just another chatbot or workflow. It's a truly autonomous agent that bridges the gap between conception and execution. While other AI stops at generating ideas, Manus delivers results. We see it as the next paradigm of human-machine collaboration, and potentially a glimpse into AGI. Now let me show you Manus in action across 3 completely different tasks. Let's start with an easy one. In this example, we'll ask Manus to help screen resumes. I've just sent Manus a zip file containing 10 resume documents. Since each Manus session has its own computer, it can work like a human. First unzipping the file, then browsing through each resume page by page, and recording important information to documents. Manus works asynchronously in the cloud, which means you can close your laptop anytime, and Manus will notify you when everything is complete. Of course, you can also give Manus new instructions at any time. Here I've sent Manus 5 more resumes. After carefully reading all 15 resumes, Manus provides its ranking suggestions, along with candidate profiles and evaluation criteria as supporting materials. This is pretty good, but I prefer a spreadsheet. Let's have Manus create one. Manus has its own knowledge and memory, so it can teach Manus that the next time it handles a similar task, it will deliver a spreadsheet right away. In this example, we'll have Manus conduct some research. It needs to filter New York properties based on multiple criteria. For complex tasks, Manus first breaks them down and creates a to-do list. Manus begins by searching and carefully reading articles about the safest neighborhoods. Then Manus researches middle schools in New York. Next, Manus writes a Python program to calculate my budget. Based on my budget, Manus filters listings on real estate websites. Finally, combining all the information gathered, Manus writes a detailed report and compiles all the resources. In this example, we have Manus perform a correlation analysis between stocks. For professional data, Manus can access authoritative data sources through APIs. After validating the acquired data, Manus begins writing code for data analysis and visualization. For Manus, coding isn't necessarily the goal, but rather a universal tool for solving problems. It looks like Manus has completed the data analysis and visualization. But interactive data visualization is even cooler, so I asked Manus to create a website based on these data. With my permission, Manus deploys the finished website online and provides me with a shareable link. Let's see what Manus has created. What you've just seen is just a small sample of what Manus can do. In fact, on benchmarks designed to evaluate general AI assistants, an early checkpoint of Manus has already achieved state-of-the-art performance, and it's only getting better. Beyond benchmarks, Manus has been solving real-world problems on platforms like Upwork and Fiverr, and has proven its capabilities on Kaggle competitions. This wouldn't be possible without the amazing open source community, which is why we're committed to giving back. Manus operates as a multi-agent system powered by several distinct models. So later this year, we're going to open source some of these models, specifically post-trained for Manus, inviting everyone to explore this agentic future together. The name Manus comes from the famous motto, Mens at Manus, mind and hand. It embodies the belief that knowledge must be applied to make a meaningful impact on the world. And this is precisely the promise of Manus AI. To extend your capabilities, amplify your impact, and be the hand that brings your mind's vision into reality. We can't wait to see what you will achieve with Manus.
Okay, so we're back and I'm in the home stretch. I'm gonna wrap up in about 5 minutes. Let me just share my screen one more time. Okay, so seeing the demo with Manos, and I believe, and I've been saying this, and I think a lot of them saying that 2025 is the year of AI agents. And we're seeing a lot of companies coming out with AI agents that can do stuff, that can do tasks. The key feature of AI agents is their autonomy. They can function and make decisions even in your absence. So think about our healthcare system in Africa. Think about the processes. Think about the workflows. Think about using, leveraging, or adopting, integrating AI agents into your workflow, into your process to help you do things better and to help enhance the experience of the patient. At the end of the day, I believe so much that there has to be a human AI collaboration, that this is a collaboration between humans and artificial intelligence, and that we must be willing to take baby steps to get ready for the future. And getting ready for the future, again, what we are doing today, continuous learning, trying stuff, trying new stuff, adaptability, and of course, industry engagement within and across industry, looking at what's happening in other industries and how we can bring it into the healthcare space in Africa. From a business perspective, of planning and designing, clarifying what's going to be and what is right or what is wrong. Thinking about how to set up digital centers. This is Providence Care here in Kingston, Ontario, Canada. Their Center for Digital Health Research. I mean, thinking of how to set up AI centers of excellence, that digital centers or AI centers of research that continues to investigate not just the theoretical aspect of the technology, but integration within our communities in Africa. Uh, Definitely a balanced approach is something that I preach consistently, balancing between AI and the human, but also as we incorporate AI to think about the ethical side of things, to think about some of the things that can go wrong and see how we can address some of those issues. Again, taking those baby steps. And I always share this with folks, who are working in different industries, that as AI begins to do a lot of the things that we're doing today, the ability to think outside the box, to adapt, to think about things from unconventional perspective becomes even more important for us as humans. Data analytics literacy becomes very important for us as humans. AI literacy becomes very, very important for us as humans. Why? Because with generative AI, oh my goodness, you can do so many things within the healthcare space in Africa and across other industries. But it requires us to be brave, to be bold, and to be practical. For any organization, the biggest threat they face is not really AI, but it's somebody else, knowing how to leverage AI to do things better, faster, and cheaper, enhancing the customer experience and accelerating product delivery. Eric Hoffer makes a statement that I put out every time I speak. In a world of change, the learner shall inherit the earth, while the learners shall find themselves perfectly suited for a world that no longer exists. Oh, I have this training that I do for organizations, for individuals, regards to AI, that is a lot more extensive. But this is the future. This is the future of healthcare across the world. And I really hope that the African continent will not lag behind in this space. Thank you very much.